Gentlemen and ladies, of course, we are back with another video, and today's video we're going to be talking about a specific glaucoma treatment in the form of an eye drop called Levobunolol. I think I'm pronouncing that correctly. That has actually been recorded in medical literature to cause depigmentation of the iris, where it has literally taken people's eyes from brown to blue. And I think there are a few reasons that this is not like super common knowledge among people, that this is actually possible, that this medication does this. Because the medication was really mostly used from like the 1980s until the early 2000s, and even then it wasn't prescribed as like a main treatment when it came to beta blockers that would reduce hypertension in the eye. So it's really been like phased out in the last, I guess, like 15 to 20 years, kind of congruent with the rise of the internet. So it's like, if more people were using this, I think there would be a lot more reports of this happening, just due to the internet. But kind of this, situation where it wasn't really prescribed very much to begin with, because there seemed deemed better options for the actual, use of treatment with this. Also, it's like, if people did get this side effect, I guess, which you could deem as a positive for looks maxing specifically, it's like the internet wasn't around, and so, if your eyes lightened, who the fuck are you going to tell? So there have been a few documented cases of this actually happening, though, which we're going to be getting into. So hope you guys enjoy this video. Iris color changes are a recognized side effect of certain eye medications, particularly prostaglandin analogs, which typically cause hyperpigmentation or darkening of the iris. However, iris depigmentation or lightening, resulting in a shift from brown to blue or lighter shades, is exceedingly rare and has been documented in association with beta blocker glaucoma medications, specifically Levobunolol. This video reviews the pharmacology of Levobunolol, the clinical significance of iris pigmentation changes, and details every known recorded instance of iris lightening attributed to this specific medication. 3 cases have been reported in medical literature involving bilateral depigmentation after long-term use. Proposed mechanisms include alterations in local prostaglandin concentrations or increased drug affinity for pigmented ocular tissues. Glaucoma management often involves topical medications to reduce intraocular pressure, which is IOP, including beta-adrenergic blockers like Levobunolol. Levobunolol hydrochloride 0.5% solution is a non-selective beta blocker that inhibits aqueous humor production, thereby lowering IOP. It is commonly prescribed for open-angle glaucoma and ocular hypertension. Common side effects include ocular irritation, bradycardia, and bronchospasm, but rare ocular pigmentation changes have been noted. Iris pigmentation is determined by melanin content in the iris stroma and pigment epithelium. Changes in iris color can occur due to various factors, including aging, trauma, inflammation, or medications. As mentioned earlier, prostaglandin analogs are well known for inducing iris hyperpigmentation by stimulating melanogenesis, affecting 10 to 50% of patients depending on baseline iris color and duration of use. In contrast, iris depigmentation, loss of melanin leading to lightening, is uncommon and typically associated with conditions like pigment dispersion syndrome or bilateral acute depigmentation of the iris, as well as heterochromatic iridocylitis. Medication-induced depigmentation is rare, with Levobunolol being the only glaucoma drug linked to this phenomenon in published reports. Levobunolol is a potent non-cardioselective beta blocker with equal affinity for beta-1 and beta-2 receptors. Administered topically in the form of eye drops, it reduces IOP by 20 to 30% through decreased aqueous humor secretion from the ciliary epithelium. Systematic absorption can occur, leading to cardiovascular effects but ocular side effects are primarily local. Pigmentation-related effects are not typical for beta blockers. Unlike prostaglandin analogs, which upregulate tyrosinase and increase melanin synthesis, beta blockers do not directly influence melanogenesis. However, animal studies suggest beta blockers accumulate in pigmented tissues due to melanin binding, potentially leading to prolonged exposure and toxicity in melanocytes. Clinical washout studies show longer drug persistence in dark, irided patients compared to light irided ones, supporting this affinity. Iris lightening from depigmentation is generally cosmetic and asymptomatic without impacting visual acuity or IOP control. Unlike hyperpigmentation, which is often concentric and noticeable in mixed color irids, like hazel, depigmentation can result in patchy or diffuse lightening, sometimes shifting brown eyes towards blue or gray tones. Reversibility is uncertain, and in reported cases, changes persisted after discontinuation. So, the first recorded case of Levobunolol inducing iris depigmentation was in 1999. A 68-year-old Caucasian male with open-angle glaucoma presented after 5 years of exclusive bilateral levobunolol use at a concentration of 0.5% twice daily in the form of eye drops. He reported bilateral iris color change from brown to blue. Slit lamp examination confirmed diffuse depigmentation without transillumination defects, inflammation, or pigment dispersion. IOP was controlled, the specific values were not reported, and no other ocular pathologies were present. The patient had no history of surgery, trauma, or other medications. Hey guys, I'm just jumping in here during editing because when I did the original recording of this video, then I kind of like fucking butchered the second case that I was going to go over. But really the second and the third case are very similar, and they're both from the exact same abstract that I found on the internet. So there's not really a whole lot of detail I can go into on either of them. I'll get into the second patient in this, abstract, which is the third case of this being recorded. But yeah, basically the second case was a 59-year-old African-American woman with a 10-year use history of levobunolol, and her and the third case, both had very similar outcomes. So anyways, yeah. Case 2 and 3 were both part of the same research paper that was published. But yeah, it was a 72-year-old African-American female with an 8-year history of bilateral levobunolol use. Same dosage as the others of 0.5% twice daily. And it presented similar findings. Slit lamp confirmed bilateral depigmentation, and she noted a lightened iris color. Exclusion of other cases, like no surgery or uveitis, was thorough. Artificial tears were her only other ocular medication. As in case 2, the mechanism was attributed to pigmented tissue binding with higher drug levels in darker irids, potentially inducing depigmentation. No reversibility data was provided, and further studies were recommended to explore causality. So, as I mentioned previously in this video, there haven't really been any, confirmed ways. There just hasn't been enough research as to why this happens, but there have been a couple of proposed mechanisms of action that could be causing this. The first being prostaglandin modulation. Levobunolol may inhibit prostaglandin synthesis or alter local concentrations, disrupting melanin homeostasis. Prostaglandins typically promote pigmentation, as seen with analogs, so reduced levels of prostaglandins could lead to depigmentation. The number 2 proposed mechanism is pigmented tissue affinity. Beta blockers bind to melanin, accumulating in pigmented irids. Chronic exposure may cause melanocyte dysfunction, resulting in pigment loss. This explains higher incidence in darker eyes. Cases 1 and 3 that we talked about had brown irises. Levobunolol-induced iris lightening is a rare bilateral phenomenon documented in 3 cases after 5 to 10 years of use. Affected patients, who were all ages 65 to 72, noticed shifts from brown to lighter blue tones without functional impairment. Further research, including prospective studies in histopathology, is needed to elucidate causality and prevalence. Now, I know that you might be thinking, well, Blake, this is only 3 case studies of Levobunolol actually doing this, so this is super fucking rare, and, I'm not going to start using this for the purpose of looks maxing because, there's just limited data, which I would agree, I would totally agree with that. That's definitely a valid argument. My rebuttal to that, though, would be the fact that this Levobunolol is not really used at all today. And it's not, beta blockers in general have kind of been phased out with the use of prostaglandin analogs now coming onto the scene for treatment of glaucoma and ocular hypertension. Beta blockers were the dominant glaucoma treatment from the 1980s to the early 2000s before prostaglandin analogs like latanoprost became first line. And even of beta blockers that were prescribed from the 1980s to the early 2000s, Levobunolol was only prescribed in about 5 to 10% of cases because the preferred one was timolol. So not only with the use of the internet, let's just think about this. So if somebody had iris depigmentation with this medication, if it was nowadays, if people were getting prescribed this, you're going to go on Reddit, you're going to talk about it, you're going to go on forums, you're going to talk about it, see if anybody else has encountered this issue, or not really issue, side effect. But number one, the, sample size group of people who use this are, number one, usually old people. So people age 60 plus are going to be most likely to be prescribed this medication. And in the past, when this was mostly prescribed, and even then it wasn't the first primary prescription, timolol was, it's people didn't have access to the fucking internet. So if they encountered this side effect, who the fuck are they going to tell? How is this going to be a well-known thing? And even then it's there are only 3 reported cases of this that have been documented in clinical literature. But it's how many of these cases existed where grandma shows up to fucking eye doctor or whatever, and, eye doctor's oh yeah, look, or she says, hey, look, my irises have lightened, and then they're just oh, cool. You know what I mean? It's not, oh, well, are you encountering any vision problems? Do you have any pain or discomfort or irritation? No. So then it's you just overlook it. It's not some main concern because this depigmentation doesn't seem to cause any downstream negative side effects. But yeah, I think that's something that should really be taken into account. It's the people who are getting treated with this, not very many to begin with because there were better options, and it's almost been completely phased out. Really the only people who are still using this are people who have been on it for decades at this point, and they just haven't changed their prescription yet. And it's are these old people, is grandma going to go on Reddit and talk about her iris depigmentation or go on .org and talk about her iris depigmentation? No. So, really, I guess what's the conclusions of this? I genuinely think this could be a legitimate option if you wanted to lighten your eyes without seemingly significant side effects. There is slight systematic absorption in some cases, which can cause, really the main thing would be causing hypotension or a drop in blood pressure because beta blockers can do that. But even then, it's not going to be that big of a deal. And, obviously this was FDA approved and prescribed to old people. So if it really had significant cardiovascular, detrimental effects, then it wouldn't have been prescribed at all, most likely. So, really, and even noted in the case studies that we covered, it's there weren't any other negative side effects associated with this iris depigmentation. So really, this seems to be quite a safe option if you wanted to try to depigment your eyes with this. Obviously, follow all rules and regulations and laws in your own country. Don't do anything illegal. I'm not a doctor, yada fucking yada. But yeah, I mean, this is very interesting. And really the only downside I'd say is the amount of time that it would take. This is noted in all these cases to be with chronic use, so like over the span of years. But even still, like one of the cases that we covered, the guy mentioned that he noticed gradual depigmentation of his eyes, so it happened over time. So and I mean, to go from brown to blue eyes, like that's a very significant difference. That's a very significant change. So it's hard to say. Yeah, it might have taken 5 to 10 years for it to fully depigment, I guess, to blue. But at the same time, it's like, how long will it take to first start to notice depigmentation of the iris? Who the fuck knows? There's just really not enough research on this, but we do know that it's possible. As we've discussed, it has happened before. And I really think that due to kind of circumstances around this medication, like I said, just not being prescribed very much, and also mostly being prescribed in a time where the internet wasn't around and the age group of people using this are not internet friendly individuals in the first place, it's like, I really do think there's, a lot of potential with this medication. So, am I really going to use this? I don't fucking know. I mean, I'm fine. I have green eyes. I'm kind of fine with how my eyes are. I'll just wear colored contacts. You know what I'm saying? But, if any of you guys want to try this and take before and after photos and post them on the internet, fucking go for it. Obviously, read up on this shit, do your own research, weigh the pros and the cons. But, yeah, this is really like the only thing I could find when it comes to natural. Well, I mean, I guess it's not natural depigmentation, but it's not like a surgical laser depigmentation or something, or some really fucked up thing with your health that causes depigmentation of the iris. So, yeah, super interesting shit. And I'm curious to see. Hopefully this video will get some views and kind of bring this more to the mainstream, and people can start to try this and see if it has the same effect in them. But I would just say, if you're going to start using this, I would highly recommend, dude, take before pictures before you start, and take progress pictures and fucking stick with it. Because that would be very interesting. I mean, it would be cool to, in 5 years from now, be able to see, oh yeah, this is now a mainstream way to lighten your eyes, and take them from like brown to fucking blue. Because legitimately, if this could be a way to repeatedly be able to take people from brown to blue eyes, with basically no negative side effects, I mean, that would be pretty fucking cool. And obviously that would be something that, if proven to be repeatable for, just normal individuals, this would probably become a very mainstream, super good looks max. So yeah, try this out. And I mean, yeah, document this shit, and I would love to hear about it. So more new videos are going to be coming. I've been out for a while because I got into a car accident and had some complications in the hospital, and been pretty fucked up. So that's why I haven't been making videos. I've been seeing some comments, people thinking I'm dead and shit. I'm not dead. I'm still alive. Almost died, but yeah, we're still here, thank God. Also, for those of you asking in my DMs, yes, I am doing one-on-one looks maxing / fitness / dating coaching again after being unable to do it for the last few months. So if you need help sourcing hormones, pharmaceuticals, Levobunolol, if you want to experiment with it, as well as designing custom hormone protocols, skincare routines, what else? Hair loss prevention and regrowth protocols, workout routines, diet plans, penis enlargement and sexual performance protocols, cosmetic procedure advice, cold approaching, speaking in charisma, dating, relationship advice, basically everything male self-improvement wise, I have multiple years of hands-on experience with, as well as at this point thousands of hours of research under my belt. So Yeah, if you want to improve your life, let's hop on call and get you moving in the right direction based on your specific goals and situation. Because, you know, a lot of people like sell a fucking course, and the same thing does not apply to two completely different people, you know? So, especially when it comes to more advanced stuff. So, yeah, a link to that will be in the description. And after the first 20 guys join, the price is going to be doubling. But if you're one of those first 20, the price is locked in for as long as you want to work with me. And you can cancel at any time. So, yeah, in October before the accident, I had almost 60 guys in there. So, yeah, lock that in before the spots fill up. And if not, don't worry, a lot more free informational videos like this will be coming soon. So, make sure to subscribe to the channel and also follow me on Instagram and TikTok when you get a chance. The links to those will be in the description as well. And yeah, that's basically it, I think. Anyways, thank you guys for watching, and I'll catch you in the next video. Goodbye.